Good evening. Trying to get everything set up and ready for our live on osteoporosis today. I've had a very busy day, I'm sure some of you have too, so we'll just wait for a few more people to join and then we will get going. Let's put that on silent. Great, got a few more people that have joined now, so let's get going. Today we're going to go through what is osteoporosis, are we able to prevent it, and what are our treatment options available if we do have it. So osteoporosis is just a gradual loss of bone mineral density over time, and osteoporosis is actually a natural part of aging for all of us, but for many people it can actually be quite debilitating as well, because some people obviously have it worse than others. And we notice this particularly in women due to the menopause. As soon as you get to that menopause age, we get a drop in estrogen, and as a result that can then lead to, or it does lead to, a drop in bone mineral density as well. But men also notice it too from around the age of 50 onwards. It can be a really debilitating condition. It can lead to fractures, fear of falling, and overall health decline as well, because what we tend to see in people is they get osteoporosis, so then they get scared to go outside or do anything or move because they've got this fear around it, and then they get more frail and they get more likely to have a fall, and then the cycle kind of continues. You can't actually prevent or do anything about osteoporosis if you're then not going to move because you're so fearful of walking and moving and getting out of the house. So there's lots of things that we can kind of talk about today to do with that. So our bone mineral density is also going to lead to higher fragility scores as well as we get older if our bone mineral density has reduced. And osteoporosis is classed as a chronic disease that does get worse over time. Previously, interestingly, osteoporosis was just diagnosed via a DEXA scan. So that is a scan that you go into which says to you, you've got this much bone mineral density, this much muscle, this much fat tissue available. And if you're below a certain threshold, it would come back and everyone would say, okay, well, you've got osteoporosis. What we actually look at now is not just someone's DEXA scan, but someone's risk of a fracture in the future. And that is a score that we can kind of put together, and that can then help us to decide that maybe you're osteoporotic even though you've either not had a DEXA or your DEXA scan doesn't look that bad. And if you've previously had a fragility fracture, so a fracture as a result of being frail, then you'll fall into this category as well of having osteoporosis. So bone tissue that we've got in our skeleton is constantly being absorbed and replaced throughout our whole lifespan. So across the space of around 19 years, you've actually got a whole new skeleton because your cells have died, you've had new ones that have come in. So within that time, you've effectively got a new skeleton almost. And bone mass decreases when the rate of absorption increases the rate of production. So we're getting more bone mineral density absorbed than we are getting produced, and then we end up in this deficit as a result. And peak bone mass is reached about the age of 20 for most people. And those who develop loss of bone mass prior to that are likely to have a higher risk of fractures and of developing osteoporosis. So we actually see as well a natural loss in our bone mineral density about the age of 37, and it's interesting because scientists haven't worked out why we see this. So we know at the age of 37 both men and women have a reduction in bone mineral density, but as of yet we're not sure why, so there's nothing we can really do. And then we have that larger drop at menopause, like I mentioned before, and also for men above 50, we see a bit of a drop as well, but not as large as those that have got menopause. Women commonly lose 1% per year peak bone mineral density, which is obviously quite a lot. And that's for up to 8 years after menopause has ended. So it's quite a long time to continue losing your bone mineral density for. And then that is called what we kind of call primary osteoporosis. So primary is going to include sort of just natural, there's been no other reason that we've kind of had it, it's as a result of menopause and that kind of thing. We get secondary osteoporosis as well, and this is often due to prolonged use of medication. So this is something that I really commonly see in post-cancer patients, because the medication that they're given and the chemotherapy, radiotherapy that they're given lowers their bone mineral density and then causes them to become really frail in older age. And obviously if we look at the demographic of people that have got cancer, often they are older anyway, so again it just increases all of this risk of having increased bone mineral density. Low calcium intake or absorption as well can greatly increase your chance of developing osteoporosis, and lifelong calcium intake is actually really important for keeping our bone mineral density high. So what we have is up until about the age of 20, we're heavily laying down bone mineral deposits, and the way that we're doing that is through doing lots of on-feet exercise and activity. So previously a lot of kids would be, you know, running around, barreling around outside, playing with other children in the street and that kind of thing, and what we are seeing now is a lot of kids that are more tied to their computers at home, their TVs and their screens, and I'm wondering how that's going to affect their bones in 40, 50 years time. But actually you want to encourage children to be doing as much on-feet activity as possible. So as much as an exercise like swimming, for example, is really good, it's not actually improving their bone mineral density at all. So we want to be doing the activities like football, rugby, netball, any kind of running, jumping is really good. All that high impact is great for laying down bone mineral deposits. Kids that haven't done that, or kids that haven't had good calcium intake for whatever reason, could be that they were allergic to dairy and weren't getting adequate supplements or anything like that, that can ultimately affect their bone mineral density later on down the line as well. Other things that can also affect bone mineral density, so excessive alcohol consumption as well, that can really decrease the body's ability to absorb calcium. So if you can't absorb the calcium, you then obviously can't help regenerate the bone. It doesn't mean that just because we lay down most of our deposits by the age of 20 that there's nothing we can do beyond that point. We can, but that's just where a lot of that growth happens, is in the under 20s. And you know, bones respond to load. So the more load applied to it, the more physically active you are, the higher bone mineral density is going to be than someone that is quite sedentary. Our other like secondary factors that can cause osteoporosis are hormone levels. So if we've got too much of something, too little of something, this is potentially going to impede the body's ability to produce and maintain adequate bone mass as well. So that's lots of things that we want to be looking at. Sorry. So it's estimated that roughly 200 million people have osteoporosis. So that shows you actually this is really quite a massive problem and affects a lot of people, and the incidence rate increases with age as well. So over 70% of the over 80s are classed as osteoporotic, and it's more common in females than it is in males, as we mentioned earlier. And in the developed world, around 2 to 8% of males are affected, and around 38% of females are affected with osteoporosis. So, you know, approximately 4 in every 10 females are going to be osteoporotic. And there are around 9 million fractures related to osteoporosis worldwide every year. And 1 in 3 females and 1 in 5 males over the age of 50 will have an osteoporotic fracture. So it's actually really high. And what we notice as well is areas of the world that have less vitamin D through sunlight compared to other countries, these regions typically get more of those fractures as well than the people living at sort of lower latitudes. So obviously preventing it, like I said, does come down to doing things mainly before you're 20. But actually, the older we get, we still want to be doing lots of exercise. If we're not exercising, we're definitely not maintaining the bone mineral density that we've got, and we're definitely not going to improve it. So doing as much on-feet activity, as you can do, is absolutely excellent for the development of our bone mineral density. Making sure that you're eating a really balanced diet. Smoking and drinking aren't going to help you. Occasionally drinking isn't going to harm you, but drinking to excess or drinking regularly is going to stop that calcium absorption. Smoking, as we all know, is just terrible for healing, amongst lots of other things. So they're the kind of things that you can do. There's more and more research now as well into resistance training, like weightlifting and sort of strength training, and how that actually affects osteoporosis. And what we know is that the stronger we can get our tendon attachment to the bone, the better chance we have of not getting a fracture in that area. So if we think of what a tendon is, a tendon basically just links a bone to a muscle. When we have a slip, trip, fall, anything like that, what we can have happen is where the muscle contracts, it can then rip off a bit of bone that comes with the tendon. So we want to try really hard to keep that area nice and safe and strong, and that's called an avulsion fracture. So to help prevent these avulsion fractures, we want to be exercising as much as possible, particularly strength training, because that's been shown to be really effective in helping to prevent those fractures. So that's something we can do as we get older as well. And when we're sort of looking at our treatment options also kind of fall under prevention as well. So I'll kind of mention more of them in a minute too. So going through sort of our treatment options, medication is an option and it can reduce spinal fractures by around 30 to 70% for hip fractures, for spinal fractures, and for hip fractures around 30 to 50% reduction from medication. So there's been quite a positive effect seen in the first kind of 6 to 12 months of treatment. HRT during menopause, some women, it doesn't really agree with them. Some women absolutely swear by it. I've got patients that are on both sides of that fence. But actually that's been shown to help slow down that bone mineral density loss that we get over time after the menopause as well. So if you are a woman approaching menopause age, that might be something that you want to consider taking just for the osteoporotic reasons, even if your menopause symptoms actually aren't too bad. And we can also have biophosphates as well. They can help to slow the rate of progression, which again is just another form of medication. And there's also 6 monthly injections that you can take as well. And again, that can help slow down the rate of progression of osteoporosis. So there are treatment options available that fall under the medication side of things. But when we're looking at physio side, we've still got lots of options available for physio. So like I said, with the prevention, actually, one of the things is strength training. That is also part of our treatment as well. And the reason for that is if I've got someone coming into my clinic and I have got a few people, actually, they are all females who are concerned because they have osteoporosis, and they're concerned about a few things. One, am I going to break myself if I start exercising? Am I going to cause more damage and more harm than good by exercising? And provided you're doing the right things, and absolutely not, all it's going to do is be helpful for you. And then I have the group of ladies that are also really concerned that they're going to fall, they're going to trip, so they don't want to leave the house as well. And actually, like, strength training is great for them, and doing weight bearing exercises. And what we find with doing the weight bearing exercises is you get a lot stronger. So as a result of that extra strength, you're then less likely to go on and to have a fall as well. And the falls are what cause the fractures, really. People that are osteoporotic, you're way more likely to get a fracture than someone that isn't. But it doesn't mean that, if you're sorry, I've completely lost my train of thought there. So if you're way more likely to get a fracture than someone that isn't, but if we can prevent that from happening by getting you stronger and more able, then you're less likely to have a fall to start with, because falls are what then lead to the fragility fractures, which then often lead to hospital admissions. And often in hospital admissions, you end up having a reduction in kind of quality of life. And often, if you've ever had a family member going to hospital, you see them rapidly decline whilst they're there. They're not moving as much as normal. They're not being independent. They can't eat their own food. All of those kind of things, really impact them and their mood. So the more we can prevent that, the better someone's quality of life is anyway. So weight training, strength training is one of the really positive things that we can do to help prevent and also to treat osteoporosis. Stretching and flexibility is actually really important too, because a lot of people that have osteoporosis often end up quite like this, quite what we call kyphotic. And it can then help with that posture. So if we're improving the posture for someone, we're going to then again just be improving your quality of life. You're going to be more comfortable, you're going to have less pain, and again it can help prevent falls as well, because you've got a better kind of anatomical way of walking about and standing and holding yourself too. So we kind of look at it from a postural control perspective, but also it's, you know, people don't want to be walking around all hunched up, so it really has a positive effect there. Postural exercises, so like I said, I did just mention posture briefly then, but actually specifically working on posture related exercises to prevent us from ending up in these positions, and permanent structural changes that can happen. These exercises can help us result. So by postural exercises, sometimes there'll be areas that we know tend to be tight, so we'll work on some mobility for those areas, and there's areas of muscle that we know tend to be weak, so again we'll start working on those areas to get them a bit stronger, so we can prevent that postural change from occurring. And obviously the best time to do all of this is ideally before you've been, you know, diagnosed potentially, but if you have just been diagnosed recently, you get on top of it now, don't delay. The other exercise that we look at as well are balance exercises. Like I sort of briefly mentioned before, if you can prevent a fall from happening, then you're likely to prevent a fracture as well. So we like to start with some quite basic balance exercises. Often I don't even have people standing on one leg or anything like that. I might say, okay, we're going to stand on 2 legs and you're going to shut your eyes. I'm just standing really close to that patient, just making sure that they feel safe and they feel happy. We're then going to try and move that to maybe what we call a tandem stance. So you can have your eyes open, but your feet kind of back to back in front of each other like that, almost like you're doing a tightrope. So if you're at home and you can try that now, give that a go and then put on the comments and let me know how you found that, because it can be deceptively hard. So you can do it one way, you can do it the other way, and if that's easy you can shut your eyes as well. Some other balance work, if someone's a little bit more advanced, then we will do single leg stuff. So start with single legs, eyes open, then we'll do single legs, eyes shut, and then we might try adding in cushions or wobble boards or anything like that as well, depending on obviously how advanced that patient is too. And then education is something that physios, we're educating our patients all the time on various different things, but actually like safety is paramount with people that do have osteoporosis as well. So we might be educating you on your footwear, on things around your home. You know, if you've got a rug that's on a slippy floor, I'm probably going to advise that you don't have that. Making sure you've got good lighting at home, checking your eyesight regularly, because, you know, something I hear from a lot of people is, well, I fell because I didn't see it. I'm like, oh, you didn't see the curve, you didn't see the step. You know, they haven't had their glasses checked in a while. So it's really small things like that that can actually make a big difference to preventing falls, which prevent those osteoporotic fractures as well. And high intensity training actually as well has been shown to be really good, and we kind of look for low force but dynamic weight bearing. So, you know, it's sort of high intensity training, but we're not getting people like jumping about the room or anything like that. We're getting people working hard, getting their heart rate up, being dynamic in our movements, so moving around quite a lot, without having to put lots of jumping stuff into it, can be really effective as well at improving kind of that osteoporosis. And like I said, we're not going to get massive changes in bone mineral density as we get older, but if we can prevent it from getting any worse, and we can prevent ourselves from falling and improve our strength and our balance and our posture, then all of that is gonna be helpful. So yeah, the key takeaway from today is that many people get the osteoporosis diagnosis and it terrifies them. So they do stop moving, and this is just the worst thing that you can do. Actually, you need to just be doing more and more and more. If you have any questions related to today's session, then just pop them on the comments now and I will happily answer them. And if not, you can always pop them on the post afterwards. And if you do have osteoporosis, or you know anyone that does and you think that they'd like to hear this, then please just invite them to the group. Or you can book an appointment with us as well, and we can go through all of the options available for yourself or for that person, take you through some exercises that you can also practice at home that will be safe but also get you to a point that you want to be. So I'll just wait a few minutes to see if anyone's got any questions. Malik, I know that you've asked a question about ACL injury rehab, non-surgical, best surgical. That's not what we're kind of discussing today, that's for another day. And actually we know with ACLs that our research says it it kind of doesn't matter either way. So if you want to drop me a message about that, then let me know. I'll happily discuss it with you. Fab. Don't think we've got any other questions. Thank you very much for joining me today. I hope you all took something away from this about how you can go help yourself with osteoporosis. Have a lovely evening.